Good morning. Thank you so much for joining us today.
Good to be here. Thank you.
So, what do you think are some of the major challenges that adolescents across Africa face today?
There are many challenges that adolescents face across sub-Saharan Africa, but some of the major challenges are early marriage, school dropout, and violence.
Okay. And do you think that cash transfers can play a role in addressing these issues that teenagers can face?
Yes, so for example, most of the cash transfer programs that are government run in sub-Saharan African countries are targeted at reducing poverty and improving long-term resiliency of households. And so they're not targeted to facilitate safe transitions to adulthood. But what we know from the risk factors for marriage and school dropout and violence is that poverty is very often intricately linked to these adverse outcomes. And so by reducing poverty at the household level, there may be trickle-down effects among the adolescents living in those households. And so increased economic security at the household level may allow adolescents to attend school more and longer. It may reduce the risk of early marriage and also some risks around violence.
Okay, well that's good. That's encouraging. So is there any evidence that cash transfers can help to protect children from issues such as child marriage and childhood violence specifically?
We do have growing evidence from across the region that cash transfers can help facilitate safe and healthy transitions to adulthood. So for example, we've seen here in Ghana, the LEAP program has been able to increase school attendance among secondary school age children. So those adolescents who are living in LEAP cash transfer households are more likely to be attending school than children who are in equally poor households but not receiving the LEAP transfer. And we see that from countries across the region, these cash transfer programs run by governments have strong positive impacts on school attendance. In addition, we've also seen some mixed evidence from across the region. But for example, in Kenya, we've seen that the government cash transfer program was able to delay marriage and pregnancy, which are often very much linked. And in addition, we've also seen in other countries some mixed evidence to suggest that there may be positive effects of these cash transfer programs on adolescent well-being outcomes.
Well, that's very good. So are cash transfers enough to address the main challenges that adolescents in Africa face today?
We do see that cash transfer programs are very beneficial, and they're having very positive impacts on reducing economic insecurity and improving well-being at the household level. And we've seen in some countries that it's been able to delay marriage and pregnancy, also getting children into school. All of these are very beneficial to adolescents. But what we do know is that cash is not a silver bullet. It alone cannot address all of the barriers that adolescents face in their lives. And so more is also needed. So investment in schools, investment in health facilities, and facilitating those linkages between cash transfer households and the other services that are available. Because of their level of poverty, these households are not always reached by the services that are available. And so if we can facilitate stronger linkages between those households and the services available, we may see more powerful effects.
Okay, good. So do you have any examples of where we've seen such links between cash transfers and other programs?
Yes, so the evidence around the linkages and how they've benefited adolescents is very limited, and we're still collecting more evidence on that. But we have seen examples here in Ghana. The cash transfer households are linked to the National Health Insurance Scheme. So that's one example of linking these households to other services. In other countries, such as in Zambia, we've seen that cash transfer programs by governments can have even more powerful impacts when there are other barriers that are being addressed. So in communities where health facilities are better, of higher quality, we see that mothers are better able to deliver with health professionals as opposed to delivering with traditional birth attendants. And so the cash is having impacts on that in communities where the health facilities are of higher quality. We also see around nutrition in Zambia that the cash has even more powerful effects in households that, for example, have water that's collected from a protected borehole as opposed to an open well or something like that.
Okay, well that's great. That's really encouraging, and thank you so much for sharing this with us. Thanks so very much, Tia.
Thank you.
Thank you.